Hi, my name is Mohammad Ali, and today I will be critically evaluating a toddler learning experience from ASICA, um, connecting with practices series, especially this story time to nap time transition scenario. This presentation forms a part from my evaluation of curriculum processes, and teaching strategies, learning outcomes, and broader implications for professional practice. I will also reflect on how learning experience aligns with earlier learning framework to version 2.0, national regulations, and the requirement of high quality early childhood pedagogy. So, I will begin by examining the context of the experience and how it shaped teaching learning. Next, I will evaluate how toddlers engaged and what they reflected and which learning outcomes were achieved. And then I will assess the pedagogical approaches, the learning environment, and assessment strategies used. And I will also identify possibilities for extension, discuss the role of professional practice, demonstrate how experience feeds into planning cycle. Finally, I will conduct with the key insights gained from this situation evaluation. So, the learning experience takes place in a toddler room during the routine transition from shared story time to nap time. While this appears simple, transitions such as these pedagogically rich moments for toddlers, routines are deeply connected to emotional safety, predictability, and sense of belonging. Their developmental stages requires strong emotional support and consistent structures and sensory appropriate environments. The context strongly influence teaching because toddlers communicate their needs primarily through actions, body language, and emerging verbal expressions. Their background may influence on how they perceive rest routines. For example, some families co-sleep, some do not nap at all, and others are usually particular comfort objects or rituals such as prayers or lullabies. And these factors shape how the educator plans and implement the routine. From community perspective, early childhood services in Australia operate within shared societal expectations around children's well-being, which includes safe rest opportunities. Consequently, the educators must balance regulatory requirements with culturally responsive and relationships-driven practices. The educators in the scenario appear aware of these contextual influences, using a calm tone, soft lighting, and predictable cues and warm physical presence to support the children. So next, look at the children reflection on their own learning. An important element of evaluation is identifying how toddlers reflect on their own learning. At this age, reflection is rarely verbal and is expressed through choice making, gestures, behavior, and emotional responses. So, in this scenario, children demonstrated reflective awareness through actions such as selecting their own mat, choosing a comfort item, or verbally acknowledging tiredness. Some children express sleep now, or I want to book again. And these comments show that the children understood both the purpose and sequence of the routine. So, non-verbal and word reflections were equally meaningful. Calmer breathing, slower body movements, seeking proximity for to pair familiar pair educators. moving independently towards the sleeping area. These actions indicate that the children were not simply complying with the educator's instructions, they were actively making sense of transition and using their developing agency to participate in it. So, children's engagement in experience. During the story time, toddlers displayed their joint attention in pointing to the pictures, finishing repeated phrases, and interacting socially with peers. This engagement demonstrated early literacy skills and memory, recall, and narrative understanding. The transition itself also provides evidence of cognitive and emotional engagement. Many toddlers anticipated what would happen next. They responded to verbal cues, gathered their belongings, and moved towards the rest area with minimal prompting. Their engagement also reflected social learning. Some children followed peer behavior, while others supported each other by hanging out soft toys or waiting for their friend to settle. This shows early empathy, cooperation, and group awareness. And from an educator's perspective, these behaviors can be interpreted as evidence that children understand and internalize the routine. They signal what the learning outcomes, particularly those connected to well-being and belonging, are being achieved. So, learning outcomes achieved. A key requirement of this evaluation is demonstrating how we know what learning occurred, and in this scenario, several learning early year learning framework version 2.0 outcomes were all clearly evident. So, first one is outcome one, identity. Children showed an autonomy by choosing how they wanted to settle, and they also demonstrated trust in educator, reflecting strong, secure relationships. So outcome two is connectedness. They engaged in shared participation, maintaining positive interactions with peers and educators during the transition. Outcome three is well-being. This outcome was central. Toddlers displayed developing emotional regulations, responded to calmer cues, used strategies like deep breathing or cuddle soft toys to support their settling. Outcome five is communication, and children express preferences, recall parts of stories, responded to verbal cues, and intercepted nonverbal communication such as gesture and tone of voice. The educator assessed these outcomes through observation, attention to children's rhythm, and responsive adjustments. The consistency of children's behavior and moving smoothly into rest routines, engaging with the story, and demonstrating calmness shows that the learning outcomes were not really only addressed but clearly achieved. So, evaluation of assessment techniques. This assessment strategies is in this routine were appropriately aligned with the taller development and early year learning frameworks version 2.0 expectations. So, learning intentions included supporting self regulation, strengthening routines, predictability, promoting communication skills, nurturing and secure emotional attachment. Learning goals were observed and practical, such as children moving calmly to their mats, and particularly in story time and using comfort objects independently. The educators assessed their children learning primarily through informal observations during the transition, monitoring cues such as yawning, rubbing eyes, or slowing movements. and interpreting the verbal expressions and tracking participation over time to note progress and patterns. In terms of resources, the educator provided a developmentally appropriate picture book and comfortable mats and soft lighting, familiar comfort toys, and a quiet environment. While these assessment cues techniques are strong, this there is room to deepen them by collecting written observations more consistently, linking evidence directly into earlier language learning framework outcomes, integrating children's voices more intentionally, documenting sleep routines for each child to ensure cultural responsiveness. So these improvements would strengthen accountability, better informing planning, and enhance communication with families and colleagues. So next is pedagogical approaches. The pedagogical approach in this scenario reflects a blend of intentionally teaching and relationship-based practice, responsive caregiving, and emotionally attuned interactions. The educator used intentional techniques such as soft voice modulation, calming body language, predictable sequencing, modeling of relaxation behaviors, simple verbal cues like "let's find your mat." And these strategies directly support toddlers developing executive function and emotional regulation. The regulation pedagogy was central, and toddlers rely heavily on secure attachments when transition between activities. The educator engaged in children's eye level and used warm facial expressions and responded sensitively to individual needs. For example, comforting a child who hesitated to, or providing area time for a child who preferred a slower pace. And curriculum decision making was also evident. The educator deliberately treated the transition as a learning opportunity, not a procedural task, and the story time served as not only as a traceable moment but also a calming ritual preparing children philosophy and psychologically and emotionally for test. To enhance pedagogically practice, further educators could incorporate routine cards, bilingual storybooks, explicit breathing strategy exercises, and stories for peer helpers. These strategies would help support diverse learning needs and enrich their routines and educational value. So the physical and environment played a crucial role in this routine. The story area was warm and inviting and organized with soft furnishing. This supported shared engagement and effective attentiveness. The sleep area was structured to prioritize safety, supervision, comfort, reduce sensory stimulation, child autonomy. The lighting was dim, noise levels were controlled, and mats were placed to ensure both comfort and safety. Importantly, the layout allowed the educators clear lines for the of supervision, demonstrating compliance with the regulations and requiring active, ongoing supervision during the rest periods. So, several meaningful extensions, such as deepen learning beyond this routine, includes calmer corner, self-soothing blankets, mindfulness, movement, cultural inclusion, and story-based follow-up activity, visual sequencing cards. So next is national regulations the framework to version 2.0 alignment. So these regulations include Regulation 81 requires safe, appropriate sleep and rest practices. Regulations 103 and 105 ensures environments are safe, hygienic, and appropriate. Regulations 122 and 123 require active supervision of child at rest. And national law section 165 to 167 ensures the children's health and safety well-being. And version 2.0 alignments the educator embedded earlier language framework and principles such as secure relationships, cultural responsiveness, and high expectations and continuity of learning. Earlier learning practices were evident and intentionally teaching language, learning environments, assessment for learning and responsiveness, professional practice reflection. So the strengths is the I recognize the importance of emotional attunement and predictable routines and calm educator presence. So these are the essential teaching tools in the toddler pedagogy. And I have also developed a strong understanding of how routines support our learning outcomes and can confidently interpret young children's verbal and nonverbal cues. There is also area for growth, invention, professional learning needs. So this evaluation includes the current planning and marks for being a new one. So to conclude this story time, our the time nap transition in the toddler's rear room offers opportunity for learning and developing. The experience supports communication, belonging, and emotional regulation, identity, and well-being. This reflection affirms that the everyday routines are powerful curriculum moments that we shape children's current experiences and future capacities with thoughtful reflection and ongoing professional learning, such as routines, can become deeply meaningful and inclusive and educational. Thank you. And these are some references regarding this presentation. Thank you. See ya.